What's up guys, Derek, moreplates.com. Today we're going to be talking about a 150 milligram per day Anadrol cycle, essentially prescribed by a doctor that we get some pretty interesting data from to derive what kind of muscle growth is actually, expected from this compound, specifically oxymethylone. So basically the protocol entailed starting with 50 milligrams a day and then titrating up to 100 milligrams a day and then titrating up to 150 milligrams per day and assessing body composition changes. So in the following two patients, each was administered a 50 milligram per day monthly step up in Anadrol, and month one, they did 50 milligrams per day, month two, 100 milligrams per day, month three, 150 milligrams per day. So they stayed on Anadrol for 3 months straight, which is very notable because a lot of people, they talk about how this is so liver toxic, it needs to be cycled off of in 4 weeks or 6 weeks. And this is a prescription from a doctor in a therapeutic, clinical setting here. So each patient was also administered testosterone cypionate 100 milligrams per week, which was stopped at week 12 at the end of the 3 months. Patients were monitored monthly for any lab changes, especially liver function. The diet and exercise are tailored to the patient. So as can be seen from the Dexa scans, there was a significant change in their body composition, which was maintained after stopping anabolic androgenic steroids purportedly. I don't know how long after this actually was, but patient one, their before and afters, we can see here in the before, we have the body composition changes included an increase in lean body mass from 59.5 to 63.4 kilograms. So that's a 3.9 kilogram gain. A decrease in body fat from 32.3 to 24.9 kilograms. So lost 7.4 kilograms in body fat. A decrease in total body weight from 94.8 to 91.5 kilograms. So negative 4.3 kilograms. Overall, these changes reflect a decrease in body fat from 35.2% to 28.2%. So a loss of 7% body fat in the before and afters of this patient here. And this doctor's name is Dr. Michael Scally. I don't know how prominent he is exactly, but I know he is at least fairly well known in like a niche of this community for his Anadrol experiments, which is literally what I'm presenting to you right now. And they're very interesting. So there's obviously good information to bring to light, as it is a, in a clinical context. It's not some random bodybuilder with a log on, bodybuilding.com or something. It's an actual doctor prescribing this for a, purportedly a therapeutic purpose. So patient two, the statistics were the body composition changes included an increase in lean body mass from 62.3 to 71.4 kilograms. So an increase in lean body mass of 9.1 kilograms. A decrease in body fat from 22.1 to 14.4 kilograms. So 7.7 kilograms lost body fat. Slight increase in total body weight overall from 88.1 to 89.5 kilograms. So increase of 1.4 kilograms. Overall, these changes reflect a decrease in body fat from 26.2% to 16.7%, so minus 9.5% body fat. So, and in one patient, mild transaminase increase that returned to normal. Treatment included HCG and SERMs in a post-psychotherapy context. So anyways, this is 150 milligrams per day on the last month, with the first 2 months 50, and the first month 50, the second month 100. The last month 150, with mild liver stress in only one patient, purportedly, and very significant changes in overall body composition. So this sort of spits in the face of the idea that Anadrol is something that needs to be cycled off of every 4 weeks. And this isn't talking about in a recreational context. Obviously, this is just something to extrapolate for the sake of education, because obviously anyone watching this is only watching to learn about pharmacology in an educational context, So anyways, this is interesting before and afters that are presented by a doctor in a therapeutic setting, and represent very interesting findings for us to reference that like it's not very often you see like a very controlled baseline with somebody who's essentially given pharma grade Anadrol to get some sort of, metric of before and after, how much muscle did they gain, how much body fat did they lose, etc. With, no confounding factors or anything like that, just a baseline physiological level of testosterone to account for the loss of estrogen and testosterone that would occur with HPTA suppression. And the only difference being the supraphysiologic level of Anadrol. Not that there's a physiological level, but just like pushing the androgen levels in the body up to, super physiological levels. So anyways, these are some pretty significant changes and really reflect the efficacy of this compound, especially in a muscle wasting context or, HIV, cancer, chronic renal failure, and among others, as far as where it was deployed. And honestly, you can kind of take from this what you will. This is more or less me just presenting information that Dr. Michael Scally has curated that I thought was very worthwhile to present in a potentially more mainstream context that may not get found otherwise, because some of this stuff is pretty damn buried. Like trying to find some of this stuff, it's like you'll come across it randomly and then it's like only a few people have seen it and then it gets buried again, then no one really sees it for years. And I think, like bringing this to light is very interesting because anyone on my channel wants to, learn about bodybuilding pharmacology and how this stuff is all related, the history of anabolics and what they were deployed for in a clinical setting and what kind of, actual outcomes occurred in patients that were given this stuff. And this is, a representation of it in real time here. And this was the year, it looks like it was 2002, unless I'm mistaken. So 18 years ago, but honestly, fairly recent considering a lot of the studies we reference are in the 60s and 70s when we look at the representations of, like dose-dependent increases with certain other anabolics. So anyways, again, take from that what you will. An interesting case that I thought was worth bringing to light. So thank you guys for watching. Please like, subscribe. Check out my blog, moreplatesmoredates.com. Follow me on Instagram at moreplates_moredates, Facebook, Snapchat, BitChute, Twitter, TikTok, Apple Podcasts, wherever I am. Sign up for the mailing list if you want to get emailed all my articles when they go live about, whatever, bodybuilding pharmacology, hormone optimization, anything and everything, male self-improvement related, essentially. You will get sent the articles as soon as they go live, which you will not get if you are not on that list. And they are, concise, broken down by table of contents. Also have more elaborate details and citations with all of the hyperlinks to the clinical studies that I reference in them for you to delve into further if you want to for your own research. Thank you guys for watching. Talk to you soon.